I'm Paul Biddle. I'm with a cardiologist here at Nebraska Medicine. I am originally from Tennessee, born and raised there, did all my training in Tennessee, came up here from Memphis, and did my cardiology fellowship at Creighton. I do general cardiology, and what that means is we take care of patients who have the full spectrum of heart disease, whether it be high blood pressure, high cholesterol, whether it be concern because a family member has heart disease and you want to assess what's your risk, to people who have more well-defined cardiac problems such as heart failure. They've had a heart attack, they have chest pain, they're short of breath, things of this nature. The first entry into the cardiology subspecialty is usually the general cardiologist, who will sort through that problem with you and decide, do you need to take certain medication? Do you need certain treatments? Do you need specialized care, such as something related to a stent, or to advanced heart failure, or defibrillators, or even heart surgery? I felt a natural attraction for cardiology. Some of my family members had heart disease. I got to see what cardiologists did and the importance they had in my family's life. I was always attracted to the heart and all the various diseases that can affect the heart. And I thought this was something I could spend the rest of my life studying and applying. It would give you a sense of purpose. You also get a slice of life in cardiology. You get to see people who are acutely ill, who are at some of the worst times of their lives, and you also get to see them for years as they take medication for their heart disease and the ups and the downs. When I first sit down with a patient, what I'd like to do is connect in a way that lets me into this part of your life where things have gone so terribly bad. And the best way for me to understand what's happening with you is to try to sit down and live through parts of that with you. That gives me some insight not only into what your disease process is, but what it's like for you as a patient to go through this. And if you can tell me these things and we can work through this together, then we got a better chance of figuring out if there's anything we can do to make it better. I decided to go into medicine because I had a number of family members who were sick when I was younger, and I got to see the doctors, the cardiologist. Some of my family members had heart disease, so I got to interact firsthand and see what a doctor does. Then, as I was growing up, I picked jobs for my summer work that was in a hospital, a laboratory and such. So I got to see firsthand what a hospital's like, what doctors and nurses and all the other people are like who work in a hospital, and realized that's what I want to do.